their shoulder and they have a great exercise program, but they're still just, they can't quite get that last 10, 15 degrees of motion. So what we're doing here is we're looking at the SC joint, and we look at it in two ways. One of the ways we look at it is when the patient horizontally adducts and brings their hands together, putting the fingers on the distal or the proximal clavicle just off of the sternum. Go ahead and bring your hands together. What you should feel, because of the convexity, the convex concavity, is that as they do that, their clavicle should glide posteriorly. You should feel it dip in posteriorly. You can do it on yourself if you kind of do this. You should feel that collarbone kind of go posterior. It's a little bit easier to feel on a patient than it is on yourself. You have a problem with your shoulder? No? Okay. Now, the second way to assess the SC joint is having the patient bring their arms up into flexion like this. You're getting on top of the distal collarbone. Your arms are proximal clavicle. And it should go down. You should get an inferior glide with this as the arms are coming up overhead. Now, if I find a restriction and I can relate it to some sort of other mechanical finding, some sort of restriction in motion, let's say they have restricted flexion, and I find a big whopping restriction at their SC joint, you can have them. Same looking on this side. I'm going to use my fingers. This is another one where I like to use the Bill Clinton grip. Okay, you want to bring your hand across your body. And as they're coming across the body, I'm going to posterior glide. Okay? That feels great, right? This is this mobilization. It gives you kind of this generalized ache in an area where you're not used to having. You can't stand having this thing. So just be mindful of that. When you're doing that with each other. Alright, now if it's a lack of an inferior glide, as they're coming up, you're kind of right on top of that thing, and I'm going to inferiorly glide like that. I'm not more comfortable with that.
Yeah, it's tolerable, but yeah, it's pretty focal, that for sure.
So I'll use this a lot. I see it a fair amount, restriction in this area, a fair amount in patients like John's with some kind of faulty scapular positioning, or faulty humeral positioning. It doesn't just affect the glenohumeral joint, but that affects also the SC joint and the AC joint too. And sometimes those joints are not moved quite like they're supposed to. Somebody with an AC joint problem, whether it's like an AC joint arthritis or an AC joint, maybe they have a trauma, have sort of a grade 1 AC joint sprain or strain, that force kind of goes through the collarbone into that SC joint. Somebody with rotator cuff problem, perhaps there's a restriction with the way that the SC joint and AC joint moves, so that as they're doing their overhead stuff, they're not getting enough actually shoulder elevation and not getting posterior rotation of the clavicle, so they get a little bit too much motion in the glenohumeral joint and they tend to hinge over there. So that's SC joint, assessing posterior glide, assessing inferior glide. AC joint, there's just one thing, so we're going to do those two and then we'll practice. Put the arm at 90 degrees, 90-90 position, and you're externally rotating it. And what you're doing is you get your fingers on the distal clavicle, and upward attaches to the acromion on the scapula. It almost kind of widens out and it forms a little shelf. You're going to come up on top of that shelf and have your fingers posterior to that, and what you're feeling for is how much posterior rotation you get of that distal clavicle as you're externally rotating that shoulder. And if you feel that it's restricted, this also then becomes a mobilization. And what the force is, it's not just like you're straight pulling down, you're really trying to rotate that collarbone. So you sort of have to scoop your hand a little bit as you're doing that. So you're taking the end range, and then you okay?
You ever use like a towel between?
The towel,
Like in between your hand?
You could, yeah. Does it feel like I need to?
No,
Am I mashing you?
I can tell her, but I could see like on.
I didn't know
some-
you were so delicate. Delicate flower. That's all right, dude.
Everybody's gonna soft sign.
Yeah, that's right. Okay, so let's try those.